Ugh, I have such a terrible headache, and I just need it to go away. My friend told me to get some medication from the pharmacy, but there's so many options. I wish I knew how they work, the difference, and which one is the best to use. Advil and Tylenol both say they relieve headaches. I just wish I could know more about them.
Common over-the-counter or OTC medications can be overwhelming and confusing. Let's break this problem down and explain the most common two medications: Advil, or generically ibuprofen, and Tylenol, also known as acetaminophen. This video will only explain the pain-relieving qualities of these medications, but they do have many more effects and functions. Feel free to check our sources or talk to your doctor and pharmacist to learn more. Ibuprofen is classified as a non-steroidal anti-inflammatory drug, or NSAID. It works by inhibiting enzymes called cyclooxygenases, or COX enzymes, specifically COX-1 and COX-2. Ibuprofen inhibits, or blocks, both COX-1 and COX-2 enzymes without preference. While COX-2 inhibition helps reduce pain and inflammation, its COX-1 inhibition can lead to side effects such as gastrointestinal irritation. By inhibiting COX enzymes, ibuprofen blocks their ability to catalyze or quickly facilitate the conversion of arachidonic acid into prostaglandins, which are key mediators of pain, inflammation, and fever. The COX enzyme itself exists in two isoforms, COX-1 and COX-2. Let's explore each enzyme now. The COX-1 isoform is involved in maintaining body processes, such as platelet aggregation, which is when platelets clump together, vasodilation of kidney afferent arterioles, which is when the small arteries in your kidney dilate to allow for increased blood flow to the part of the kidneys that filters blood, and gastric mucosa protection, when mucus protects the lining of the stomach from gastric acid. COX-1 is expressed in tissues like the brain, kidneys, bones, and female reproductive system. The COX-2 isoform is inducible, so it increases during inflammatory processes to produce prostaglandins associated with pain and inflammation. Inflammatory processes are the body's response to injury or infection and helps to protect our body tissues and promote healing. Now, let's discuss Tylenol, or acetaminophen. Acetaminophen also acts as a COX inhibitor, but it's far more preferential, meaning it targets the COX-2 isoform 80% of the time. COX-2 inhibition is mainly involved in reducing inflammation, providing relief without causing gastrointestinal irritation. COX-2 is a key player in the inflammatory response, as it amplifies pain and swelling to help the body respond to injury or infection. But excessive or prolonged COX-2 activity can contribute to chronic inflammation and pain. Therefore, COX-2 inhibitors are effective at reducing or eliminating these symptoms. Although the following is not medical advice, scientific literature reports that both Advil and Tylenol are safe and effective treatments for common ailments like pain, headache, and fever, and determining which is better depends on the individual. This isn't a comprehensive list, but Advil can interact with ACE inhibitors, aspirin, diuretics, lithium, and anticoagulants, while Tylenol can interact with warfarin and alcohol. Always talk to your doctor or pharmacist about what medications and supplements you take, and if you can combine them with new medications before taking any new drug, even if it's available over the counter. Now let's do a little recap for understanding. Both drugs mentioned inhibit COX enzymes, which prevent the breakdown of arachidonic acid into prostaglandins, which are mediators of many bodily functions, including pain and inflammation. Tylenol is more selective for the COX-2 isoform, but both medications are safe, effective treatments of many ailments. Advil is an NSAID, while Tylenol is not because it lacks the anti-inflammatory and anticoagulatory properties.
What about safety, side effects, and brand name versus generic? There's so much to think about.
When it comes to safety, both medications have unique considerations. Taking more than the recommended dose of Tylenol can damage your liver, especially if combined with alcohol or other medications that contain acetaminophen. And overuse is a leading cause of accidental overdose. Taking high doses or prolonged and excessive doses of ibuprofen can lead to gastrointestinal issues like ulcers, bleeding, kidney damage, and an increased risk of heart attack or stroke. Avoid combining Advil with other NSAIDs to prevent compounding risks. Another question people often have is, what's the difference between brand name and generic medications? Here's what you need to know. Generic drugs are equivalent to brand name drugs in terms of active ingredients, dosage, safety, effectiveness, and quality. They undergo rigorous testing by regulatory agencies like the FDA to ensure that they meet the same therapeutic standards as brand names. Clinical studies, such as those published in PLOS Medicine, show that generics provide comparable clinical outcomes to their brand name counterparts. Generics also work in the same way and within the same time frame as brand name drugs. While rare cases do exist where individuals might feel generics don't work as effectively, such instances are uncommon and typically related to factors like inactive ingredients or individual sensitivities.